Hi, my name is Byron Arana, and today I'm focusing on the African American community, a group that has faced generations of structural oppression in the United States. Slavery and the systemic disregard of Black nurses have had a lasting impact on healthcare and on the experiences of Black Americans today. The Shakespeare quote, "What is past is prologue," reminds us that history shapes the challenges communities face in the present. For example, nursing in the US in the 1880s and 1890s was largely a profession for middle-class white women, tied to Victorian ideals of respectability and femininity, which excluded non-white women, as noted by Karen Flynn. One example is Emma Ann Reynolds, an African American teacher from Kansas who was denied entry to every nursing school in Chicago. With the help of Dr. Daniel Hale Williams, she eventually attended Providence Hospital and training for Black nurses, the first school for Black nurses. Even today, the nursing workforce does not reflect the diversity of the U.S., according to the American Association of Colleges of Nursing in 2022. About 80% of registered nurses are white. African Americans make up 13% of the population, but only about 10% of RNs. And Latinos are 18% of the population, but fewer than 5% of RNs, as reported by Dixon et al. These patterns show that historical exclusion continues to shape the experiences of African Americans in healthcare today. A key factor affecting the African American community in healthcare is implicit bias. Implicit bias refers to the unconscious attitudes or stereotypes that influence our decisions and actions. One way to disrupt bias is by recognizing where it comes from and questioning the messages behind it, rather than accepting them. Verna Myers, in her 2014 TED Talk, emphasizes that we need to move toward Black people, meaning we should build meaningful relationships, confront discomfort, and challenge stereotypes. Expanding our social circles and forming real connections helps break cycles of bias and promotes understanding. Implicit bias also affects healthcare delivery. For example, overweight and obese patients face significant barriers due to both personal bias and structural limitations. Brownell, in a 2006 study, found that many healthcare professionals hold negative assumptions about these patients, viewing them as less disciplined or less deserving of care. Beyond attitudes, medical equipment and facilities often fail to accommodate larger patients. In a study by Amy et al. In 2010, 91% of healthcare professionals reported that their facility did not have scales for patients over 300 pounds. 79% lacked appropriately sized gowns. More than half did not have armless chairs, and 40% lacked exam tables that could safely accommodate obese patients. These combined personal and structural biases discourage patients from seeking care and can lead to poor health outcomes and psychological stress. African Americans face similar forms of bias in healthcare, which reinforces disparities in treatments and outcome. This shows how implicit bias, both personal and structural, continues to create inequities in healthcare and underscores the need for awareness, education, and systemic change. The goal of upstream, midstream, and downstream health promotion is to address the causes and effects of health disparities. Downstream interventions focus on increasing access to health and social services at an individual or family level. Midstream interventions aim to reduce exposures to hazards by improving living or working conditions, or by promoting healthy behaviors at the community or organizational level. Upstream interventions, however, seek to reform the fundamental social and economic structures that distribute wealth, power, opportunities, and decision-making. These changes occur at a macro policy level, nationally or even transnationally, according to the National Collaborating Center for Determinants of Health. For the African American community, a key upstream intervention to address inequities in healthcare is mandatory implicit bias and structural competency training for all healthcare staff. This approach targets the root cause of disparities by helping healthcare providers recognize and reduce unconscious bias rather than only treating the consequences of inequitable care. By implementing upstream solutions like implicit bias training, healthcare organizations can create lasting improvements in health outcomes for African Americans and other marginalized communities rather than addressing only the symptoms of structural inequities. Thank you.